The idea of the COVID vortex and the great patient migration, as we've seen it for 2020, I suppose is, a lot of it's in the past now, but understanding the past gives us a great foundation to develop into the future. So what we've done is we've had a look at the data that's been available to us across the last 12 months that we've been managing and assisting our customers to work with, and also guiding, the other groups that allow us to, you know, just help mitigate these kind of issues. So, like the Great Patient Migration of 2020, I envisaged all the little penguins kind of moving around, and I think that was kind of a little bit of what was happening in 2020. Was that, all of the patients were told to move one direction, and they did what they were told, and then they moved another direction because that's what they were told, and there was a little bit of lost visualization for pharmacy as to where these patients were going and how much impact that was having on their businesses. So, like there is the question, and again, you guys, the answer to this one. Why did my patients go? Well, the patients went because the fear of, the COVID pandemic, the fear of being exposed, loads of different aspects of fear, and the other one was direction. They were told to do it this way, so they did it that way. The NHS directed surgeries to move patients to the pharmacies closest to them. So patients automatically migrated to closer pharmacies. They may potentially have been nominated to pharmacies that were closer to their jobs. They became shielded patients, and all of a sudden they were now moved to surgeries closer to their homes, so that it was easier for the deliveries to be done. So I suppose once we know why the patients moved, and everybody's aware of why the patients move, it's where did they go, and the statement everywhere and nowhere. There was so much interaction and moving around over the last year. In exactly as I was explaining there, the patients were told to, or not even told, they weren't, their nomination was just moved to the closest pharmacy to them, without them having a real say in it. Patients were getting higher doses of medicines less often. So the surgeries were changing their period of treatment, so the patients was at less risk of having to go into the pharmacy to or expose themselves to get their medicines. And then the third one, which I suppose is the biggest one, is that patients thinking is that the safest thing they could do was move to online. The automatic, I will have it delivered to my door. I won't have any risk here. I'll move to my Echo or my pharmacy to you. Now, a lot of our community pharmacies were able to combat this by contacting and knowing their patients quite well, and offering, we'll deliver it to you instead. I suppose one of the big things. So looking here at where our patients went to, this is just a synopsis of a surgery items for from December 2019 up to November 2020, which is the last published data from the NHS. So we can clearly see there's a lot of peaks and troughs in here. It looks like the items were growing, but the patients actually weren't growing alongside the items for most of community pharmacy. But we then can see, obviously, the troughs in the middle here, where there was either peaks of epidemic or pandemic, where the surgeries stopped or declined their amount of dispensing. And if you look at your own figures within your pharmacy or your pharmacy group, you'll see this trend. You'll see a very similar trend to this within the community groups themselves. So this just is fairly hot off the press, right? So this is, where we're looking at a community pharmacy. We're looking at the data from 2020 November, but the pandemic really hit in March last year. So this is a 12-month rolling patient growth for a cohort within our community pharmacy groups. And as you can clearly see here, there is the 12-month rolling patient growth is negative in most pharmacies, and it's negative to the tune of an average of about 3.5%. So the patient growth in all community pharmacy, or the cohort that we represent, which is about 1,200 pharmacies, individual pharmacies, dropped patient items by 3.5%. So looking then at the big thing, obviously, that is impacting the patients coming in and out of the pharmacies is the nominations. So everybody is very much looking and constantly looking at the nominations movement to see, where are my nominations going to? Am I growing the same rate as everybody else? So you can clearly see here, the patients' growth in nominations went hugely up in March last year, and hugely evaded above for online pharmacy. But you can see that there's a huge trend there, and then it kind of drifts off again to be fairly much almost year on year growth for the nominations for the cohort of community pharmacies, which we consider anything that's kind of got a 3+ group is what we consider a community pharmacy, right then up to the corporates. The corporates, I think, came out the worst out of this, and the data kind of proves that. The onlines obviously came out the best, and the group pharmacies kind of maintained their own, but did lose a number of patients. So if we look here, this is a trend of the corporates, right? So remember, if we go back here and have a look, we can see that this was the trend that we were originally looking at, and this is across the whole industry. If we move forward and look at the corporates, we'll see that they have been adversely affected constantly since May of last year, and this is an items trend. So they're adversely affected overall by the movement, mostly to online, I would think, but they didn't have the same procedures and objectives in place to keep the pharmacy or keep the patients, as we think that the group pharmacies and the community pharmacies did. You can see here then this is the corporate line. So the orange line there is the total overall growth in nominations across the last 12 months. The purple line there is the corporates. So you can clearly see that the corporates level of nominations, where they were slightly growing month on month versus year on year, they definitely weren't growing to the same level as the rest of the total industry, and definitely a lot further behind the group pharmacies and the online. So this is the community pharmacy trend. And you can see here that the community pharmacy trend is a little bit more visually pleasing than the corporate ones. There's still the big drop in May, and the big drop in August, but the months surrounding it were actually quite okay. There wasn't a massive decline, and the items in October, November, and even December and January we're seeing across our company averages are all kind of around about kind of flat. So it looks like, although the patients have decreased, the number of items that the patients are getting seems to have increased to kind of balance that out. So you're still getting the same amount of fees at the moment, because you've got the same amount of items coming through, but in time the patient decline is going to adversely affect you at some point. So there you see the community trend So the community groups, you can see the community groups are above the total average, especially around the March, April, May, and that was a big drive for the community pharmacies who understand and know their patients quite well, to get the patients onto being manual prescriptions, onto being nominated, from being regular repeats onto ERD, from getting them from being walk-ins onto delivery, and that was a very proactive approach. We've seen it through our own community groups that we've got within our customer base, but you can see it here. This is based on the whole industry across the England. So it's a good indicator that the group pharmacies were and are doing what needs to be done to keep the nominations. Now, here is, I suppose, this is the hard one to take really for a lot of us in community pharmacy, is the growth and the persistent growth of online. So remember, we've got peaks and troughs going off in the total items. We've got peaks and troughs in the corporates. We've got peaks and troughs in the communities. But this is the online. So we can see there's a considerable growth year on year in the online trends. Now, the growth percentage can be maybe a little bit distracting, because when you go from being, 20,000 items up to being 200,000 items, within a small period of time, it looks like super growth, but actually the number might not be reflective. But actually, in this case, this is the online trend, as you can see. They're fell off a little bit around about June of last year, and I think that was when a lot of the community groups realized that there was a lot of people had moved to online for COVID reasons, and then they actively went to seek to get those patients back. And that was kind of where the first phase of the pandemic kind of relaxed a little bit, was around about June of last year, where things kind of weren't as tight as they had been in March, April, and May. So we can see that people started moving around again. The online pharmacies level of nominations dropped, but then you can kind of see the peaks and troughs around about where you can see the level of the pandemic rises. The nominations to the online rise with it, and then fall as people start moving out again. So you see December there, the level of nominations dropped in December because people were moving around again in December, and they were going into their pharmacy and saying, "Can I have my medicine? Oh, we don't have your nomination. Oh, we took our nomination back." And then it goes back to, "Oh, I need to get a delivery because I'm now in lockdown again. I'm not allowed outside my door, so I need a delivery. I'm gone back to online again." For whether that's a short period of time or a long period of time, that seems to be the trend of what's happening here online, right? The big thing to take from the online is that there is 8 million items that were in community and corporate pharmacy this time last year that are now in online pharmacy. So 8 million items is an awful lot of items. So whether you believe that the growth percentages, you think they're a little bit, um, uh, you know, not reflective of what the real picture is. The real picture is that there's, in those top five um, um, online pharmacies, and there's a whole lot of online pharmacies, but these are the main five that I just focused on. There's 8 million items there that weren't there this time last year. So, in the big thing is, well, how do you combat it? So it's all good, well and good telling you all of this history. And in most cases, you guys are going to know this anyway. You know that, and everyone knows that the big winners out of the COVID was the online pharmacy. But there is ways of making sure that your patients stay with you, or not stay with you as such as in I'm forcing them to stay, but there's, in a lot of cases, people have got relationships with their community pharmacies, and if they have the opportunity or the option to stay with their community pharmacies, they're going to do that. So one of the things that we're doing now, right, is giving our pharmacy groups a transparency every week of their local areas. So say I'm just taking for example a well pharmacy here. This one here, the NG12. This one that's hypothetically say that's our pharmacy. So on their system on a weekly basis, we will send out a report to their branch that says, look, those are the other pharmacies within your postcode area, and this is the way that their nominations are moving. So if you can see this guy here, which is NG12. Oops, sorry, go backwards. The fourth one down in the independent list there, I'm not sure who it is, FEC60. They're clearly losing nominations each week, right? So you get new patients in all the time, but if your nominations are in decline, it means that you're losing more patients than you're getting in, and that's quite a big issue. But so the idea of this is, okay, well, FQK48, they're increasing their nominations almost at the same rate that I'm losing mine. What are they doing that is either taking my nominations or that they're doing better than me, that my patients want to go over there? So when you see that your nominations are in decline, which you can see on a weekly basis from the NHS data, from farm data, if you needed to, you can see your own nominations every week. But the thing I suppose is when you see -10, -15, -5, it's, well, who are they? And why are they leaving my pharmacy? And that is kind of the transparency that having, an analytic solution gives you, or just even been able to focus on that for a little while. Um, what we do here with this is we, within our PMR customers, we have created an algorithm that allows us to track the patient cycles. So if the patients have been in more than 6 times in a year, we then look at the patient, we track the number of days in between each of the visits, then we know how often their cycle is, and then we're able to say, okay, well, that patient is missing 1.5 times or 2 times their cycle, so they're lapsed. And that very quickly identifies and can identify very quickly if you look at your nominations and you see a decline, you can come straight in here and have a look and say, oh, actually, that patient is worth, the guy up here in the very top is worth £4,000 a year. So £4,000 a year, if that guy is, still knocking around, he's well worth trying to get back into the pharmacy. He's well worth giving a patient care call to say, oh, we've noticed that your nomination has moved. Is there anything that we can do for you? Are you okay with your medicines? And we have now got proof from working with our customers that this actually works. So this is exclusive to obviously our customers at the moment, but this is what we're doing with customers is called a renomination program. So what we're doing is we're identifying where nominations are being lost within our group pharmacies. Then we're identifying who these patients are, and then we're sending a list out to the branches and saying these patients are missing. Can you follow up with them and see why they're missing? So if you have a look here, we can see that this pie chart here is a very good indicator of what the return on investment is in doing a job like this. This is, it's anonymized, but it's real data. So we can see here we apply churn codes to the patient record within the PMR, and that then allows us to track when the patient lapsed, why the patient lapsed, and then how much patients, in terms of the patient lapsed last week, actually we got the nomination back. So if you look here, down here, in the green slot of that pie chart, 17.5% of our lapsed patients within the last month we were able to get back by calling them and saying, this is, so on average, these patients are worth about £700 per year. So if you get 17, and that's almost 20% of your patients back who have lapsed that are worth £700 a year, that's well worth spending a little bit of time to do it. The other side then is obviously by branch. So this is going straight back to the branch and saying, this is how well you're performing. So what we say within real world is, what gets measured gets done. And in order to ensure that your branches are cooperating with the renomination program, we create visual reporting that they can see how well they're doing. The other thing then, I suppose, about getting patients to stay with you and keep them with you is about delivering to patients. So, in 2019, 1 to 2% of our community group patients were delivered to. 1 to 2% of patients. So that's quite a small amount of patients when you think about it. And that equated to about 6 to 7% of items. So in 2019, we had about 7% of our items max being delivered to our patients. In 2021, we now deliver to 10% of our patients. And those 10% of patients equate to 30% of our items. So 30% of our items are now being delivered to our patients. So that's a really great win in order to keep patients from moving to these online pharmacies, is obviously delivering to them. So, the corporates, they are doing much, much lower deliveries. So, when we tracked back and had a look at even the COVID deliveries, the average community branch was doing an average of about 100 COVID deliveries a month. The corporates were doing an average of about 9. So, you can see that, the drift was going to be away from who's not going to deliver my medicines to me, to the patient, to the groups and the onlines that are going to deliver. The other thing that I'd say about patient deliveries, excuse this fuzziness, I must have been not wearing my glasses when I put this in. My marketing team are going to kill me. Is that you can be selective. Once the COVID dies down a little bit, you're not going to be paid by the NHS for your deliveries. So, it's worth spending a bit of time in being selective about the patients that you're delivering to. So if you go back and look at the average number of items, I'm just going to scroll it back here real quick because it's in this. You see here the latest month's average items per nomination. So if you consider for every patient, every nomination is a patient. So for Pharmacy to You, for Echo, for Boots, pill time is quite good. But if you look at the amount of items per nomination, that means that they're delivering less than 2 items per patient with every delivery. So, you want to be a little bit more clever than that. Obviously, patients who are at risk or patients who are really in need, it doesn't matter how many items they get. But when you look forward at patients that are in their 20s, they're on 1 item, they're worth, 30 pence a month plus their fee, are they worth delivering to? So, after the pandemic is over and things settle back down and now the delivery is coming out of your margin, you can be a bit more selective about who you deliver to. And maybe you don't want to be selective about who you deliver to, but you want to make sure that the people who are walking into your pharmacy with high dispensed items don't go somewhere else because they can get a delivery. You want to say to them, okay, you get 48 items in a year with us. We'd like to give you delivery. That patient's probably worth about £1,000 turnover, or if not more, each year. So is it worth, the average cost of delivery? We worked out last year is about £1.08. Is about the average cost for delivery, which you can work into your margin and still see that a lot of these patients are highly valuable in terms of delivering too. So that, that's pretty much it. I suppose the real thing that I want to get across for this is, although the past is the past, we've learned from the past that allows us to fine tune the way that we want to move forward with our businesses, so there's so much data available, whether it's from the NHS, whether it's from your own PMR, whether it's from internal BI that you're working on, or whether it's through real world. There's so much data there that allows you to have more transparency to make bigger decisions that will affect not only your patients, but also your margin at the end of the day. So that is it from me. Anybody got any questions? I'm just trying to stop sharing this for a second.